The Supreme Court has reinstated the Food and Drug Administration's requirement that women obtain an abortion pill from a doctor in person. Federal judge had suspended the rule because of the COVID-19 pandemic in response to a lawsuit from the American College of Obstetricians and Gynecologists and pro-abortion groups. Chief Justice John Roberts sided with the majority in the 6-3 decision and wrote in part, quote, "The question before us is not whether the requirements for dispensing mifepristone impose an undue burden on a woman's right to an abortion as a general matter. The question is instead whether the district court properly ordered the Food and Drug Administration to lift those established requirements because of the court's own evaluation of the impact of the COVID-19 pandemic." Dr. Christina Francis, chair of the American Association of Pro-Life Obstetricians and Gynecologists, join me now on Skype to talk more about this. Dr. Francis, welcome back. Thank you so much for coming on the show. First off, I'd like to get your reaction to this ruling and its significance.
Absolutely. Well, we at AppLog applaud this common sense decision by the Supreme Court to return these regulations to how mifeprex, or the drug that causes a medication abortion, is dispensed. These regulations were put into place in order to protect women from this potentially very dangerous medication for them. And so, we were appalled, as many other people were, when a federal judge with no medical expertise whatsoever removed these restrictions, which again were put into place to protect women from the very real complications that they can face from this medication.
And as you know, since 2000, the Food and Drug Administration has required that the abortion pill be dispensed and administered in person. Can you talk a little bit about why that suggested protocol and the need for women to be monitored while taking these drugs? What are some of the adverse reactions?
Sure. So the REMS, or the risk evaluation and mitigation strategy, that were put into place when the FDA approved mifepristone were put there because this is a potentially dangerous medication. So women that take this medication can experience significant bleeding. They can experience life-threatening hemorrhage. There's also an increased risk of infection associated with this medication. And so that's why these restrictions were put into place, to monitor the use of this medication, to try and minimize the complications that are associated with mifepristone. We do know that medication abortions with mifepristone carry a 4 times higher rate of complications than do surgical abortions even. So the fact that we were talking about lifting these restrictions, especially during a time when many people are facing health crises, was just uncalled for. It goes against medical standards. And the other reason why it's important that a woman actually see a physician prior to receiving this medication is because there's many factors that play into her risks associated with taking this medication, one of which is how far along she is in her pregnancy. And so it's really important that she see a physician to determine exactly how far along she is. The medication is approved up to 10 weeks gestation in the U.S. However, we know that after about 8 weeks of gestation, with every week that she is farther along in her pregnancy, her risk of complications increases significantly. And so one of the significant concerns about women receiving this medication through the mail is that women could be much farther along in their pregnancy. We've already seen this happen in the UK, where women have been able to access this through the mail, that women much farther along in their pregnancies are taking this medication, and they can experience life-threatening complications even more so than a woman who takes it early in her pregnancy. And the other main reason why a woman needs to see a physician prior to taking it is to rule out an ectopic pregnancy, or pregnancy outside of the uterus, prior to taking this medicine.
We have about a minute left, but I want to quickly ask you, besides physical, can you talk also about the mental health implications of this? And also, is this ruling final, or could we see this in-person requirement change once the Biden administration is in place?
Absolutely. Well, women very definitely experience mental health side effects from abortions in general, but especially a medication abortion where they're having to pass their baby at home along with really heavy bleeding. And I personally have talked to patients who weren't expecting that, and just the mental trauma that went along with experiencing that was significant. And so women do need to be aware of that. Certainly, this ruling places control back to the FDA, and so we applaud that. And this should be in the hands of medical professionals who know the true risks that go along with this medication. And I would hope that any future administration, if they do really care about women and women's health, would keep these common sense regulations in place to protect women from the harms that can go along with this medication, along with preborn children that are obviously killed by this medication.
Well, Dr. Francis, thank you so much for coming on, and thank you for your analysis. We really appreciate it.
Absolutely. Thank you for having me.